Age-related macular degeneration is kind of what it sounds like. It's a degeneration of the macula, which is the central vision that correlates to age or having more birthdays. The hallmark of macular degeneration is the accumulation of a pigment we call drusen. You can actually see on exam as kind of like a yellow pigment underneath the retina, and we see as little bumps on our images that we get here in clinic. Both types of macular degeneration, both dry and wet, can cause vision loss over time. So in dry macular degeneration, most vision loss occurs due to something called geographic atrophy, where these areas of drusen, that pigment clumping under the retina, is actually directly toxic to the retina and underlying blood supply, and the retina starts thinning out and no longer works. So we call that atrophy. And currently, there's no way we can reverse the damage that's been done. But in the last few years, there have been two medications FDA approved, which are injections in the eye that help slow the progression of disease. And there's a lot of research being done to not only improve the efficacy of those medications, but also hopefully to start bringing vision back. So geographic atrophy is bad, but it's a slowly progressive disease over time, and usually it's nothing emergent that we have to deal with. The dry form tends to progress so slowly that it's nothing to really worry about too much, and we have time to talk about treatments. That's in contrast to wet macular degeneration. Wet disease is how we describe the disease when new blood vessels start forming under the retina. Now, this might be a protective factor, or maybe the eye is trying to prevent the atrophy that we talked about, but unfortunately, the eye doesn't do a very good job of it. So when those blood vessels start growing, they're not great, and they can break, they can leak, and they can bleed, and they can cause very severe permanent vision loss, even overnight. So that's a more urgent condition that needs to be treated because of the rapid progression of central vision loss. In order to treat that, luckily, we have some very, very effective medications that are injections into the eye that cause those blood vessels to shrink down and to stop leaking, and the fluid can completely go away in most people. And with ongoing treatment, we can help prevent worsening of vision. It does require shots almost monthly for a lot of people, but there are newer treatments that are being studied. There's a surgical implant that can be placed in the eye that has longer term treatments. And there's some really good treatments on the horizon that can hopefully make it so people don't have to come in so frequently. We can have better treatments and better efficacy over time. Most of the time with dry macular degeneration, there's really no symptoms right away. It's just a very slow progressive loss of central vision. It can start with like waviness or distortion of the central vision, but most people are totally asymptomatic, and it's picked up in a routine screening exam, or if a patient reaches out to an ophthalmologist to be screened because of the family history, because it does run in families very frequently. With the wet form, you do want to be a little bit more cautious. If you're actively being treated for the wet form with the shots in the eye, they are very, very effective at treating the disease and slowing down progression and preventing it from getting worse. But sometimes the treatments aren't quite enough, and so we still recommend people watch out for those vision changes, and if they do notice those changes, again, seeking care within about a day or two is usually sufficient, or even sooner if you're really concerned about it. We always encourage patients, it's better to be safe than sorry. Just come in, we're always happy to see patients, even outside the regular routine visits. If you're diagnosed with macular degeneration, there are a few things that can help prevent progression that you can do. Those include things that just as simple as living a healthy life. That means eating a well-balanced diet, getting enough exercise, using sunglasses when you're outside. A lot of the progression comes from oxidation, and sun causes a lot of damage to the eyes. Smoking is probably the worst thing for macular degeneration, so I highly encourage anyone who's actively smoking or using tobacco products to try to quit. In addition, there are some vitamins that we call AREDS2. There's many different brands, but as long as AREDS2 is on the label, those are typically the ones that have been studied and have shown to help prevent the progression of disease. Usually I recommend those for patients with intermediate or worse disease in the eyes.